Digital functions and data will be paramount in order to enable and realize the potential we have with the current technology and a way to improve and build up the future health paradigm. We need to work out how we get gadgets, apps, big data, small data, and different digital functions to work together in order to improve quality of life and well-being for the individual and for society.
Healthcare will be much more individualized in the future, partly thanks to personal digital devices that can measure your health. Even today, people have health apps on the smartphones, and they have health wearables that allow them to, e.g., measure physical activity, pulse, blood pressure, oxygenation levels of the blood, electrical skin activity, and a whole of other factors that can tell you a lot about your personal health. These data are transmitted wirelessly to a smartphone, which can analyze all these data, tell you in detail about your health, remind you to take your drugs or to exercise more, tell you how much sun you're getting. They can also share these data with your doctor or with other patients in the circle so they can compare your health status. In the future, some of these wearables will be replaced with e.g. Digital tattoos, where you actually print electronic devices directly on the skin with a nano ink made of rubber and micro devices that can monitor all sorts of things. They are powered by action of the skin, so don't require batteries, and can all send data wirelessly to your phone for sharing with others, and they're non-invasive. And other inventions being made are smart contact lenses that measure your health. One contact lens under development can measure glucose levels of your eyes, which is good for diabetes patients. That can tell them instantly by just looking into a smartphone camera what your glucose levels are and whether you should have some insulin. Another smart lens under development can measure eye pressure, which is important for glaucoma patients, so they'll know whether they have to take some drug to reduce eye pressure to prevent this getting worse. And all of these and more inventions in the future will allow not just the individual but the society in total to get more data depending on how much data the patient is willing to share, provide very early warnings of pandemics if a lot of people in a certain region measure elevated temperature levels, which could indicate infections, and also allow the authorities to find where pandemics have started, and hence find patients here, which can be very important.